Hi, my name is Grace, and my advisor is Dr. Christine Richards. And this is a narrative review on understanding maternal mortality, a comprehensive analysis of the United States and economically similar nations. And this is just a slide of the foundational and track competencies addressed in my capstone. For introduction, there is a clear correlation between countries with higher gross domestic product, and it shows increased life expectancy. And this is attributed to socio-political and economic advancements, as well as enhanced resources for healthcare and social services. The United States has a GDP of 26.24 trillion, and despite this high GDP, the United States has also one of the highest maternal mortality rates among developed nations. In 2021 alone, there was a 40% increase in maternal deaths, where there was a maternal mortality rate of 32.9 deaths per 100,000 live births, which is a stark contrast of 23.8 deaths per 100,000 live births in 2020 and 20.1 in 2019. The other high-income countries explored in this paper is Australia, Canada, France, Germany, the Netherlands, New Zealand, Norway, Sweden, Switzerland, and the United Kingdom. And these high-income countries have lower MMRs compared to the United States, with 7 deaths per 100,000 live births or even fewer. So I wanted to explore what is causing this upward trend in the United States. And there are definitely social and economic implications. Therefore, it's crucial to address this issue. There's racial and ethnic disparities, socioeconomic status, limited access to healthcare that contribute to the maternal deaths. And there are implications, economic implications, where there's a heavy burden with direct medical costs, non-medical expenses like lost productivity, increased reliance on social services, and where in cases the mothers are the sole providers or the primary source of income, the children and family are impacted. And this is a figure that just illustrates the relationship between life expectancy at birth and GDP per capita, showing that economic wealth correlates with health outcomes across different countries. And the countries with higher GDP, of course, are having higher life expectancies. And it's demonstrated by the cluster of the wealthier nations like Japan, Switzerland, and the United States in the upper right corner. And this is a figure displaying the relationship between maternal mortality ratio and GDP per capita. And this also indicates that countries with higher GDP per capita commonly have lower maternal mortality rates, also highlighting that economic development has an impact on maternal health outcomes. So the research question that I explored was determinants at which level of the socio-ecological model significantly differ between the United States and its economically comparable counterparts. And I analyzed the risk factors across various SEM levels to determine any strengths and weaknesses in this model for each high-income country. The method I used to go about this research is that the search and selection process was structured through the preferred reporting items of systemic reviews and meta-analyses, and it's also called PRISMA. Databases such as PubMed, ScienceDirect, and Medline, as well as the search engine Google Scholar, were used. Keywords in combination of 2 or more included maternal mortality, maternal death, pregnancy-related deaths, developed countries, and high-income countries. And through this, an initial list of 41,684 articles were generated. The duplicates were removed, and the search was narrowed to peer-reviewed articles that were published between the years 2015 to 2024. The title and abstract of the papers were screened for relevance to the study subject, and then the full text assessment was performed to make sure it adhered to the inclusion and exclusion criteria, which we'll look at the next slide. And then a final selection of 28 articles were produced. So these are the inclusion exclusion criteria, and I made sure that the articles were in English, that it was geographically relevant. And because that there are different definitions for pregnancy-related deaths and maternal mortality ratio, these were the 2 definitions that would need to be met. And then the exclusion criteria are listed to the right. And this is just the PRISMA flow chart. So for the results and findings, the high-income countries with lower maternal mortality rates had more comprehensive health systems and better access to postpartum care services. These countries demonstrated higher levels of support for maternal health, including policies ensuring access to prenatal and postnatal care, midwifery services, as well as effective surveillance systems. So the data was collated and summarized in this table that you see right here. And this is just one snapshot of the different tables that I have in my paper. And this documents the article references, the countries, purpose of study, the study design, the level of the socio-ecological model, the themes, and the findings. And then the results were reported at various levels of the socio-ecological model, corresponding to the themes that were analyzed in each study. So for discussion, the socio-ecological model consists of 5 interconnected levels: intrapersonal, interpersonal, organizational, community, and policy. And these levels are not isolated, but rather they're interconnected, almost like layers of onions, where issues at one level can impact the functionality of the entire model. Therefore, addressing problems using the SEM requires a simultaneous action across all levels. 5 things were extracted from the articles, such as maternal health, which pretty much addressed the pre-existing conditions of these mothers and any comorbidities advanced to age, inequity, which included the racial disparities, as well as level of income, quality of maternity care, primarily being the source of services offered to mothers, surveillance, which encompass the type of data collection, and health policies such as paid parental leave and abortion. And these were some of the common contributing factors to maternal mortality in the United States. And these themes align closely with a specific level within the SEM, illustrating the complex interplay between individual, interpersonal, organizational, community, and policy factors. And significant disparities were identified at the organizational and policy levels, including variations in maternity leave policies, abortion restrictions, healthcare workforce composition, and postpartum care. And without targeted intervention at these critical SEM levels, efforts elsewhere will prove ineffective, perpetuating these disparities and preventable deaths among marginalized communities. Therefore, targeted interventions is crucial. Some of the recommendations is standardizing data collection and consistent reporting to improve the accuracy of maternal mortality data. The United States has a death certificate that encompasses using the pregnancy checkbox that can significantly enhance the sensitivity of surveillance. However, it was shown that physicians are not appropriately identifying pregnancy-related cause deaths. And therefore, it was recommended that if physicians start to specify the reason that they labeled this as a pregnancy-related death cause, that it can possibly help improve having more reliable data. The recommendation is advocacy for establishment of Maternal Mortality Review Committee, also known as MMRC. And some of the states within the US have not adopted this committee. And these committees ensure comprehensive data collection, helping to better understand and address the underlying causes of maternal mortality in the US. It's also crucial to integrate anti-racism training throughout medical education. Studies on the effects of implicit bias training are limited. However, research suggests that incorporating mindfulness, coalition building, and personal retrospection alongside broader structural changes can significantly reduce harmful effects of implicit bias. Another crucial recommendation is global collaboration and exchange of best practices. A perfect example is the Nurse Family Partnership, which originated from the United Kingdom and Australia. And this involves nurse home visits to first-time low-income mothers, focusing on prenatal health, parenting skills, and child development. And this program demonstrated benefits such as improved prenatal health, reduce preterm births, and overall better overall maternal and child health outcomes. And these are just the references. Thank you.